the fetal period. So this is much more easy compared to the previous lectures, but only you have to by heart the things. You have to try to remember the things. Okay. So this is the objective. So describe the different changes accompanying the weeks of fetal development. So we have seen the changes in the first, second, and third week, and now we'll study in a very fast manner throughout the fetal period. What are the changes which will be taking place? So as you know, the fetal period starts from the 9th week. Before that, it will be the embryo. So the first 3 weeks will be the germinal period. Okay, so this is the fetal period starting from the 9th week of the embryogenesis. Genesis means development. So development of embryo is called as embryogenesis. So from the 9th week till birth, we call it as the fetal period. So for the first 3 weeks will be the germinal period. Starting from the 4th to 8th week will be the embryo. Now it is called as the fetal period. Okay, starting from the 9th week till birth. Okay, so this is the fetal period. Now we will study about the fetal period in a very fast manner. Okay, the developing organism now is called as the fetus. Till now it was called as embryo till the 9th week. Now starting from the 9th week till birth, it will be called as the fetus. Okay, the fetus, because now it looks almost like a human, okay, with some features. The fetus continues to grow much more faster. Now this is how we can see here. So here, this is the period during the first, second, and third weeks. Okay, then so this was the germinal period. Then we saw the fetal period, the embryonic period from the 3rd week, okay, onwards. So this will continue up to the 8th week. This is called as the embryo. Okay, from starting from the 3rd week, this is the 3rd week. So this is the first week and second week. Okay, even 3rd week is included within the germinal period. So where we saw that it will be single cell, then it becomes multiple cell, then all the changes. Then from the 4th week, it will be called as the embryo. So these are the changes taking place from the 4th week to the 8th week. Now what we are studying is from the 9th week onwards. So 9th week up to the 9th month. Okay, these are the changes which are taking place in the fetus. Okay, so we'll not go into very details. So we'll specifically see some of the changes in each week or in some groups of weeks. Okay, so it becomes much more easy to understand what are the some particular changes taking place in different ranges of weeks. So starting from the 9th week, as we said, from the 9th week will be the fetal period. So now we see what are the changes taking place, especially from the 10th week to the 12th week, what are the changes will be taking place. Now the fetus has some features. As you can see here, you can see the limbs are there, the upper limb, lower limb, head, the trunk, everything. So now it starts measuring almost 30 to 80 millimeters. 30 to 80 millimeters will be the size of the fetus, or it is just 1 to 3 inches in size. In inches, it will be 1 to 3 inches in total length of the fetus. Then at the same time, there will be changes which are taking place in the abdomen. That is called as the intestinal rotations. Okay, that we will study when you study the gastrointestinal system. At that time, you will see how the changes are taking place within the intestine. So there will be something called as the rotation of gut. So the details you will study when you go to the level 6. Okay, these are the, just now you remember that there will be changes taking place in the intestine. That is called as intestinal rotation. Then the facial features continue to develop. So as you can see here, now there is development of face. Now some features are starting appearing on the face. Okay, the eyelids are more developed now. If you see, the fetus is closed his eyes, and you can see the eyelids can be seen there. Okay. The external feature of the ear begins to take their final shape. As you can see here, even the small, there will be a small bud-like ear in the initial stages. now there will be changes taking place within the ear itself. Okay. Then the head comprises nearly half of the fetus size. The head will be very large, almost the half of the whole of the body. If you see, the size is much more larger. Okay, and it almost approximates the remaining part of the body. Okay. Then the face is well formed, as you can see here. The face with now features of the nose, the mouth, the eyelids, everything has been formed. The eyelids close and will not reopen until about the 28th week. If you see here in the initial stages, it is open, but now it closes the eye and helps in the development of the eye itself, and it will not reopen until the 28th week of the intrauterine leaf. Okay, so whenever we talk about any period of time, 28 weeks, starting from the 0 period, that is the time of fertilization, from the fertilization up to the 28th week. Okay, so this is the 28th week. So now at this 10 to 12 weeks, the eye will close and it will not open until the 28th week. Okay. Then also, if you see in the mouth, there will be starting to form the tooth buds. Still there are no teeth, but the tooth bud starts appearing. Okay. The fetus can make a fist with its fingers. If you see here, now the fetus folds and closes its fist. Okay. The hand, especially the hand, if you see, it will close and open its hand. That is called as making of the fist. Now the finger starts appearing and it can make a fist with its fingers. Then the genital appear well differentiated. So if you see the genitals, it will be start appearing. Still you cannot specifically identify, but there will be formation of the genitals. Okay, so they are not well differentiated until the 16th week. So still they are in the primitive stage of development. Then the red blood cells are produced in the liver. Now the heart starts functioning. Okay, so actually slowly, before that there will be formation of the blood cells formed. Okay, blood cells, so that it can start flowing. So these are some of the important features which will be taking place from the 10th week to the 12th week. Okay, so we should remember these ranges and some important features which are taking place during these ranges of weeks. So here you can see here the same development of the fetus. The first 3 weeks, how there were changes taking place, 5th, 6th week. Then starting from the, now we are talking from the 9th week up to the 40 weeks, that is the 9th month. Okay. Now coming to the 13th to 16th week, now there are more important changes taking place. The fetus has grown, now it is 15 centimeters or 6 inches. From the initial stage of 1 to 3 inches, now it has become almost 6 inches, almost double or triple the size of the previous age. So there are fast growths taking place within the fetus. And a fine hair called lanigo develops on the head. Now the head, which was bald till now, no hair was there till here. Now there will be starting formation of the hair starting forming on the skull. So these are very primitive hairs. These are called as the lanigo. They have a specific name called as the lanigo. The fetal skin is almost transparent. The fetal skin is almost transparent. So if you see an X-ray or an ultrasound, you can see up to the bones. Okay, because it is totally transparent. It is so transparent, the fetal skin, that you can see even the inside part of the fetus. You might have seen a picture of that or in an ultrasound or the X-ray. You can easily see pass through the skin and see the inner structures. More muscle tissue and bones have developed and the bones become harder. So the bones can be much more clearly seen, as I said, in the X-ray and ultrasound, because the bones have become harder now. Okay, so there is the deposition of the calcium becomes harder, as well as the muscles are also growing. So you can see the muscles and bone through the transparent skin. Now there will be sucking motions are made with the mouth. So the fetus the fetus starts opening and closing its mouth. That is called as sucking motions. Okay. So that is this motions can be seen within the fetus. Okay. So if you see here, it has opened its mouth and it will close. Okay. So this is called a sucking motion of the fetus. Then the meconium is made in the intestinal tract. Just like the feces is formed, similarly, because of the sucking of the motion of the mouth, the fetus starts drinking the amniotic fluid. So as we have seen previously, now the fetus is completely covered by the amniotic fluid and the yolk sac has become almost degenerated. Now when it starts moving its making sucking motion, it starts drinking the amniotic cavity, and a feces like thing is formed within the intestine. This is called as the meconium. The liver and pancreas produce fluid secretions. So the liver and the pancreas, they also start producing some fluid secretions, even though they are not very specific secretions from the pancreas and the liver, like these specific secretions, but they are just fluid-like things which are coming out. Okay, they are initial stages of functioning of the liver and pancreas. From week 13, so now you can start predicting the sex, but it will be much more clear at the 15th or the 16th week when the main development of the external genitalia is finished. Now, if you do an ultrasound, especially at the 16th week, usually we recommend the pregnant lady to do her ultrasound at the 16th week. So at the 16th week, if you see, you can easily identify the external genitalia and you can make out external features can be seen, and you can make out whether it is a male or a female. But you should remember that the determination of sex is at the fertilization itself, depending on which type of sperm has fertilized, whether the X sperm or the Y sperm. Okay, but what you can see with the eyes, with the ultrasound, okay, externally by the development of the external genitalia can be made out at the 16th week. So this is just, you can make out with an ultrasound whether it is male or female, but the sex determination is already complete at the by the sex determination takes place at the time of fertilization. Okay, so at the time of fertilization, depending on which chromosome, which sperm, whether the X sperm or the Y sperm has fertilized. Okay, so sex determination is at the fertilization, and external genitalia formed at the 15th and 16th week, and you can make out by the ultrasound whether it is the male or the female. Okay, so there are two different features. Coming to the abdominal wall closes, as we said before, there will be intestinal rotation. Again, this is all part of the level 6, when we will study that the intestine will come out of the abdomen and they rotate, and by the 16th week the intestine will go back, and then there will be closure of the abdomen. Okay, so this is called as the initially there will be open abdomen, then it closes. So if the abdomen doesn't close, there will be conditions when at the time of birth some fetuses may develop, come out with the abdomen wall open and the intestine out. Okay, so that all those things you will study. Once you understand the basic normal, then we will talk about the pathological changes. Now coming to the week 17 to 21. So again, now the fetus has reached 8 inches from the previous 6 inches. Now it has grown up to the 8 inches or 20 centimeters. And the lanigo covers the entire body. Previously we saw lanigo are just on the head. These are the special hairs, I said, primitive hair, which are developed on the head only. Now by the 17 to 21, they are seen on the entire body, not only on the head but on the entire body. So you might have seen fetuses taking birth with the hair on them. Okay, so these are the primitive hair, which will shut down later. Now the eyebrows and eyelashes also start appearing. Just like the hair on the entire body, even the eyebrows, the hair above the eye and the eyelashes start appearing there also. You see the hair developing. Then even the nails appear on the fingers and toes. Till here there was development of the fingers and toes, okay, to well differentiated thing. Now even the nails start appearing on the fingers and toes. Okay. The fetus is more active with increased muscle development. Now the fetus starts moving, okay, because of the increased growth and more activity with the muscle development. This movement is called as quickening. Quickening usually occurs. The mother and others can feel the fetus moving, okay, because the fetus have become well developed now, much more developed. And it has become more active with the increased muscle development. So now the fetus, every few minutes or so, it starts moving. So this is called as quickening. This is a very important sign that the fetus is alive. Okay. So by the after 16th week up to the 21st week, the fetus, the lady start feeling. Okay. The fetal heartbeats can be heard with the stethoscope. Now the physician or the doctor can put a stethoscope on the belly of the lady, pregnant lady, and he or she can actually hear the heartbeats of the fetus. Okay, so there is a specific method by which you can hear the heartbeats. Okay, that again you will be trained to feel as well as hear the heartbeats. Okay. By the 23rd week, the fetus has reached almost 11.2 inches or 11 inches. From the 8 inches here, it has reached now the 11 inches. And the weight is almost a kilogram. Okay, a kilo. Then the eyebrows and eyelashes are well formed here. So here in this, they start appearing, but here they have well formed. They are well formed here. By the 23rd week, the eyelashes and eyebrows have well formed, and all of the eye components are developed. So now, as we saw in the initial stages, it has closed its eyes. Now, during its closure, all the components of the eye are being developed. Okay, and by this time, the eye components have well developed. The fetus has hand and startle reflex. So the fetus can show some movements which are called as the startle reflex. Then footprints and fingerprints continue forming. So now even the footprints and the fingerprints, as you know, the fingerprints are very specific to each person, because of which we give the fingerprinting. Okay, similarly, so these fingerprints and footprints, even footprints are very specific. So these are formed at this stage of life, that is the 23rd week of intrauterine life. Okay, so whenever it is in the uterus, we call that life as intrauterine life. Okay. Now, even the alveoli, that is the lungs, within the lung, the most specific part where the respiration takes place, that is called as alveoli, or the air sacs are forming in the lungs. Now, even the air alveoli, till now there was lung, but there was no cavity within the lungs. Now, cavity is being formed within the lungs, and it is even forming the specific region where the air exchange will take place, that is the alveoli. Now by the week 27, the fetus has much more grown to almost 15 inches from 11 inches. It has grown up to the 15 inches or 38 centimeters. And the fetus now is from 900 grams, it has grown up to 1.2 grams. These are very fast growths which are taking place within the fetus. Now the brain is also develops rapidly. Now this is the time when the brain starts developing very rapidly, and even the nervous system, the whole of the nervous system develops enough to control some body function, not all, but at least some reflexes and body movements are controlled by the nervous system, because the nervous system now it is developing, as well as even the the specific part of the nervous system, that is the brain, is rapidly developing. Now the eyelids open and close. Now till now it was the eyelids had closed and there was development of the eyes. Now that the eye has well developed, now the eyelid starts opening and closing. Okay, so it will be closing and opening its eyes. The respiratory system, while immature, has developed to the point where the gas exchange is possible. As we have seen, the alveoli are formed during this period. So now even though the respiratory system is immature, it is not totally ready for respiration. But now, if in any case, if the fetus comes out, it still has the possibility of some gas exchange. Okay. Now, by the week 31, the fetus reaches a length of about 38 to 43 centimeters, that is to 15 to 17 centimeters. Here it was 15 centimeters, now it has gone up to the 17 inches. And the weight is from 1.2 kilograms to here it has reached up to the 1.5 kilograms. 1.5 kilograms. The amount of body fat rapidly increases. Till now there was development in the skin, the muscle, the bone, other things. Now the body start developing the fat. Now after all the important components have developed, now it starts accumulating fat. Okay. Then rhythmic breathing movements occur, but lungs are not fully mature. So as we have seen, the lungs have developed here to a point where there can be some exchange of gases. Okay, but there are no exchange of gases taking because the fetus is still inside the mother's womb. The rhythmic breathing movements start appearing, even though it is not respiring, but the movement which is responsible for the breathing, that breathing movements can be seen within the fetus. But the lungs are not fully mature, as we said, it is not fully mature lungs, but just the breathing movement. Even though there is no respiration taking place, respiration will start only after birth. Once it comes out of the fetus, so the first the breathing and the crying of the baby will be the first breath. Okay, so here just there will be some rhythmic movements taking place, okay, which is getting trained to respire. Then the specific part of the brain, like the thalamic brain connections, which mediate sensory inputs form. So the thalamic part of the brain, which especially is responsible for the sensory connections, it starts developing very well developing. Okay, so that the fetus can feel some sensations. Bones are fully developed but are still soft and pliable. Okay, so the bones, as we have seen, they are much more developed now, but still if you actually compare, they are still soft and pliable, so they can easily break if there is any kind of injury, but it is well safe within the mother's womb, so nothing will happen, but they are still soft. The fetus begins storing a lot of iron, calcium and phosphorus. Okay, so the fetus starts storing within its body a lot of extra iron, just like it starts storing the fat. Now it also starts storing the iron, calcium and phosphorus. Okay, where it is coming from? Everything is coming from the mother's blood. Okay, so all the nutritions, everything as we saw before, it is all supplied by the mother's blood. Even though if the mother takes the input is less for her, even then the fetus will not compensate. It will take its quantity of iron, and the female, the mother, will suffer actually. So that's why we recommend a better nutrition for the mother, so that both the mother and the fetus can well develop. If the mother is taking less nutritious food, then it will be the fetus will not compensate, but it will take its role and it will utilize to store, and the mother will usually suffer in this case. Okay, so it is always recommended to have better nutrition for the pregnant lady. Now coming to the week 35, this is a very well developed stage when the fetus reaches a length of almost 16 to 19 inches, that is 40 to 48 centimeters. Okay. The fetus is about now 2.5 to 3 kilograms. Okay, 2.5 to 3 kilograms, which is the normal weight of the fetus. The lanigo, that is hair covering the body, begins to disappear. Now if you see here, the lanigo, which were the temporary hairs which had developed on the skull and the body, now start disappearing. Now start to disappear, especially from the body. They will start shedding. Okay. The body fat increases. As we saw in the previous stage, there will be the storing of fat. Now the body fat has increased. Now the fetus actually looks much more better, okay, with for a lot of quantity of fat, that is called as the baby fat. Then the fingernails reaches the end of the fingertips. Now the fingernails, as we saw previously, were started developing. Now it has already reached to the point where they are can be felt at the fingertips. Now a baby born at the 36th week has a higher chance of survival, but may require medical intervention. So usually after this stage, because the fetus has already reached the size which it has to reach, 16 to 19 inches, and the weight is good, 2.5 to 3 kilograms, and there is a good quantity of fat within the body. So now the fetus, the lungs also have grown to this stage, and now the fetus can survive if it delivers. Okay, so if it delivers earlier, that is called as the early stage of development before the completion of full pregnancy, that is by the 36th week or so. But nowadays, with a lot of medical advances, it can survive even at the early stage. Okay, at a very early stage by 32 weeks or so. So with medical advances, it can survive much more earlier. So if there are chances of such kind of things, they start giving some specific drugs like the steroids, which helps in the early development of the lungs. They give the steroids, which help in the early development of the lungs, which is one of the important component for the fetus to survive, because it has to respire once it comes out. Okay. Now, by the 36 to 40 weeks, it is well developed, and now there are chances of delivering at any time. The fetus is considered full term at the end of the 39th week of gestation. 39th of the 40th week is the normal completion of gestational period, but it can go up to the 41 or 42 weeks sometimes. Okay, but normally it is after 39 to 40 weeks, we say the fetus has completed its development. Okay, that is called as the gestational age. It may be 48 to 53 centimeters or almost 19 to 21 inches by now. So it is a good size when the fetus has grown to 21 inches or so. The lanigo, that is the temporal hair, have gone except on the upper arms and the shoulders. Sometimes you can see the fetus has some lanigo hairs on its upper arms and shoulder, because these lanigo hairs have not shed. If not, they have shed on all other parts of the body except the skull. Okay, they have shed on all the other parts of the body. Sometimes they can remain in the upper arms and the shoulders. The fingernails extend beyond the fingertips. By this stage, actually, if you see, the fingernails have grown much more larger than the fingertips. So as soon as there is birth, if you see the fingernails, they are longer than the fingertips itself. So you are supposed to cut them because they are much more longer, and it can hurt the newborn. Okay. The small breast buds are present on both sexes. So breast buds are present in both the male and the female, and sometimes after birth, if you even press it, there will be secretion of a small quantity of fluid called as witch milk. Okay, witch milk. So you will study all these things again in detail when you come to that stage. Okay. Then the head hair is now coarse and thickest. Now the head hair, so all other parts of the body, the lanigo hair have disappeared, but on the head, now they are much more stronger, thicker and longer. Okay, this is the stage when the fetus is ready to deliver. So when it delivers, that is called as the newborn. So these are the different stages which are important. So I will just give you just some important things. By the 10th and 12th week, if you see the facial features start appearing, then the eyelids also are developing, and there will be a development of the external ear buds, as well as the face will start forming, the tooth buds are formed, the genitals start appearing, and the red bloods also are formed. By the 13th to 16th week, it will reach almost 6 inches, and then there is formation of the first hair, that is called as the lanigo hair. And the fetal skin will be transparent, and there will be development of the bones, thickening of the bones, which can be seen through the transparent skin, even the development of the muscle. And there will be sucking motions, which can be seen with the mouth of the fetus, and there will be meconium within the intestinal tract. And the liver and pancreas also are forming, and they also start secreting some small quantity of fluid. And there will be development of the external genitalia, which will help in the determination of the sex by the ultrasound by this time. And the abdominal wall closes at this stage. By the 17th to 21st week, it has grown up to the 8 inches, and you can see the lanigo hair on the entire body, and even the eyebrows and eyelashes. And there will be appearance of the nails. And the fetus starts showing movement, that is called as the quickening. And you can hear the fetal heart sounds through this stethoscope. By the 23rd week, it has grown up to 11 inches, almost a weight of 1 kilo, and the eyebrows and lashes are well developed, and the eye components are being developed, because the eyes are closed now, and the eye components are being developed. And the fingerprints and the footprints are developed, and the eye will start appearing. By this 27th week, the fetus has reached 15 inches, and the weight is almost 1.2 kilograms. 1.5 is the next stage. This is the 1.2 kilogram stage, and the brain and the nervous system start developing. And the eyelids open and close now. And even the respiratory system, even though it is not mature enough, but there will be some exchange of gases is possible if it comes to this world. By the week 31, the fetus reaches almost 17 inches, and the weight is almost 1.5 grams, and there is rapid now the deposition of the fat, iron, calcium, and the phosphorus. And there will be some kind of breathing movements, even though it cannot be called as respiration. It is some breathing movements, and the specific brain part, that is like the thalamic, which is important for sensory, will develop, and the bones are fully formed. By the week 35, this has reached a point where if the fetus comes out, it can survive easily with some medical interventions. And the fingernails are up to the fingertips, and there's a lot of fat in the body, and the lanigo hairs start disappearing, and the weight is almost 2.5 to 3 kilograms. And the 40th week, 36 to 40th week is the stage when it has completed its gestational period. Now it is ready to come out of the mother's womb and survive as an individual separately. So this is called as the gestational age, that is the 39th week when it is complete. Now it has reached almost 19 to 21 inches, and the lanigo hairs disappear in all the parts of the body except the upper arm and shoulder. And the head hair have grown much more larger, longer, and they are coarse and thick. And the fingernails are developed beyond the fingertips, and even the small breast buds can be seen in both the male and the female. So all these are the stages. This is the lecture where just you have to by heart the things and try to remember important things here. So this lecture is much more easy. Just you have to just by heart the things. So if you have any doubts regarding this, you can ask me.
Thank you, doctor.
So no doubts.